Have an amendment at the desk.
The clerk will designate the amendment.
Amendment number 3, printed in Part D of House Report number 118-115, offered by Mr. Roy of Texas.
Pursuant to House Resolution 524, the gentleman from Texas, Mr. Roy, and a member opposed, each will control 5 minutes. The chair recognizes the gentleman from Texas, Mr. Roy.
I thank the chair, and I noticed that my friend and colleague from Texas talks about the current system discriminating. Well, the current system discriminates against small businesses and people who can't afford the massive cost of insurance or care. And that's the truth. My colleague refers to an icky kind of coverage. Well, the fact of the matter is we have a large segment of the American people who are trapped in so-called coverage, but they're not able to get care. And that's why we're here. We're trying to increase options for the American people. And my only concern about what we're doing with this legislation that I wholeheartedly support in trying to encourage small businesses and give them options to be able to provide better options for their employees is that I don't believe that in America you should only be able to get insurance through government or your employer. We should be freeing up the system. We should be embracing healthcare freedom. We should be creating an environment where the American people control their healthcare rather than employers and government. That's the truth. So I've offered an amendment to simply spell that out in the form of a sense of Congress, that it's a sense of Congress that the future of healthcare lies in healthcare freedom, not in socialized medicine, that Congress should take steps to address the broken healthcare system by restoring free market practices to lower costs, that coverage is not care, and expanding direct access to healthcare should be prioritized over expanding access to coverage, and patients and doctors, not government bureaucrats or insurance bureaucrats, should make healthcare decisions. Now, why do I think that? Well, the deals that are struck with the government by big corporations are the problem. For example, most recently through Obamacare, it guaranteed their actual growth and profit. For example, Anthem had a 344% increase in government revenue from 2010 to 2020. United Healthcare had a 198% increase. Cigna, Anthem, United Healthcare, and Humana have seen an average increase of 562% in their stock prices from January 2011 to January 2021. But here's the kicker. In 2018, for at least 3 of these companies, the majority of their revenue comes from the government. United Health, 53.4%, Anthem, 58.7%, and Humana, a whopping 86.9%. It is that corporate cronyism that is reducing options. They're making it more difficult for the American people. And the fact is, for Americans that are trapped in coverage through Obamacare, like, for example, when I came to Congress as a member of Congress and I was put on Obamacare, not some gold-plated plan that flies around on the internet that we supposedly have, but on Obamacare, the place I went to cure the cancer that I had a decade ago, MD Anderson, I wouldn't be allowed to use. What kind of coverage is that? But that's what we're telling the American people. That's the best we can do in the freest, greatest country in the history of the world, is bow down to the altar of government and corporate America to be able to figure out how you should get care. I reserve.
The gentleman from Texas reserves. For what purpose does the gentleman from Texas, Mr. Doggett,
to claim time
seek
in
recognition?
opposition.
The gentleman is recognized.
I would yield myself such time as I may consume.
Gentleman is recognized.
Madam Speaker, I don't believe that we have noted yet in the course of this debate the great irony, the fact that this is called the Choice Arrangement Act, that we have some pro-choice Republicans here who want to give employers the choice and allow them to discriminate against different classes of their own employees. All of this happening the same horrible anniversary week of the Supreme Court's wrongful decision to overturn decades of reliance upon Roe against Wade and to eliminate the right to an abortion with an effect on women's health care that is so far-reaching, is affecting our colleges of medicine across the country and delivery of health care to women who may never have been involved in the slightest way with an abortion. They call this health care freedom today. I call it the repression and the interference with the basic health care rights of women. By the terms of their own amendment, patients and doctors should make health care decisions, not government bureaucrats or insurance companies. their Choice Arrangement Act at the same time that they interfere with what happens in our bedrooms, in our doctor's offices, and most recently even in our kitchens. They would sentence patients under this basic legislation with pre-existing conditions to a future of very few choices and no freedom. With no choices for adequate and affordable health care, this legislation, it guarantees one kind of prescription and one kind of prescription only, and that's the prescription for personal bankruptcy and unlimited medical debt from policies that do not provide essential health care benefits. It is really a shame that in a country as wealthy as ours, we still have millions of citizens who go without health coverage. But over 30 million Americans, in fact, lack coverage, and many in our home state of Texas because of the fact that our state legislature and governor were never willing to provide the guarantee we anticipated with the Affordable Care Act of Medicaid extension, as most states have done. Patients do not have a choice, do not have freedom when they suffer a heart attack or diagnosed with a dread disease or break an arm, and they lack insurance coverage that provides them the benefits that they need. Under this amendment, which is a sense of Congress resolution that really doesn't accomplish much of anything, this bill is not improved. Americans would have so much skin in the game, they'd get burned, just as the Republican dirty fossil fuel plan would burn up our planet. And it's not just the Affordable Care Act that is being targeted today. No, there's reference to socialized medicine of the kind that Newt Gingrich once attacked in this body when he suggested Medicare should wither on the vine. Contrary to Republican attacks, we've heard about public insurance programs. Seniors on Medicare value their Medicare, as do the 16 million people that signed up for the Affordable Care Act this year, and I would reserve the balance of my time.
The gentleman from Texas, Mr. Doggett, reserves, and the gentleman from Texas, Mr. Roy, is recognized.
I thank the chair. You know who should decide what an essential health benefit is? The consumer, the American, not a government bureaucrat or a corporate bureaucrat. And I guess I'll stand up for the 5,000 babies that have been born in Texas, greater than last year's number of babies in the wake of the Dobbs decision. But let me just say this. According to CBO, federal subsidies for health insurance coverage for Americans under the age of 65 will hit $1 trillion this year. Federal subsidies. The average American family spends more than $22,000 a year on premiums through themselves or their employers. Again, coverage is not care. There are other health care models that work. The Wall Street Journal showed that cutting out the middlemen in health care can due to costs, $150 a month to cover a family of 5 on a direct primary care model. A DPC practice in my district charges only $50 to $80 for an x-ray compared to the national average of $125. MRIs are $300 to $450 compared to the national average of $1,325. But it's not just primary care. For example, at the Surgery Center of Oklahoma, a direct care model, a knee replacement costs $18,000 compared to the average cost of $50,000 in the United States. And healthcare sharing ministries are driving down costs to the American people, giving them coverage and giving them options. The fact is, we should imagine an America where through a health savings account, your employer can give you real dollars rather than a faceless insurance company to pursue real care of your choice. In a flat monthly fee, you and your children have unlimited access to the physician of your choice, and you can still get insurance for the big stuff. Walking into a doctor's office and knowing how much things are going to cost. Right now, the American people do not have options. I support this bill, but this amendment is important because we need a trajectory change in this country in favor of healthcare freedom, in favor of personalized care, in favor of patients and doctors over bureaucrats at corporations who are getting rich because the government is subsidizing their corporate cronyism. I yield back.
The gentleman from Texas, Mr. Roy, yields back, and the gentleman from Texas, Mr. Doggett, is recognized.
So this is the Freedom Resolution on the week that we have the anniversary of the anti-choice Dobbs decision as part of the Choice Arrangement Act. Well, I'm reminded of the lyrics of a famous Janis Joplin song, "Freedom is just another word for nothing left to lose. No choices left, no freedoms left. This is our future under Republican plans. So much to lose, nothing left tomorrow." We need to protect more Americans from the dangers of health debt and bankruptcy. We need to assure broader coverage. There is a huge coverage gap that is leaving perhaps as many as 2 million Texans without coverage because of the failures and the ideological objections of our state Republican government. Those Americans deserve the same protection that 16 million Americans got when they signed up for the Affordable Care Act this year. They have the access to a family physician that is so very important. They have access to the essential benefits of the Affordable Care Act, getting access to the kind of care that they need to assure their family is secure. I believe that there are many improvements that are necessary in the Affordable Care Act. We were limited in being able to make those improvements when all we had for more than a decade were 60-plus Republican attempts to repeal the Affordable Care Act. Now, with this legislation, instead of repealing, they seek to undermine and circumvent. Let us reject this bill and this amendment.
Gentleman's time's expired. The gentleman from Texas, Mr. Doggett, yields back.
Close.
Gentleman from Texas, Mr. Roy, has already yielded back.
Yep.
So the question is on the